Thank you so much. Welcome. This is a very special evening. How are you, wherever you are tuned into this broadcast? This is the captain, and this is the trumpet of hope. I want you to welcome one of your friends. I want you to tag one of your friends. I want you to share this broadcast with your friends. We are live on the Trumpet of Hope app. We are live on the Trumpet of Hope page, and we are live on the Trumpet of Hope YouTube channel. And immediately after this 1 hour program, also we'll have Charles Geshuke coming in from Seattle, Washington, for a beautiful moment between Charles and I. And we're going to have a beautiful moment too. But for now, we are privileged and very privileged to have a very special guest tonight. This is Dr. Lane Aiena. Dr. Lane Aiena is the Walker County COVID Response Director. He's the Walker County COVID Response Director. This is in Walker County. We are based in Huntsville, Texas, and we are going to just let you know what you ought to know. We want to demystify. We want to inform you. We want you to know exactly what is happening out there when it comes to the issues of COVID-19. I'm going to try to speak in the best English that I was taught, but Dr. Aiena understands very well that I may maybe run away a little bit and speak in my Greek, that is my mother language, so that we can understand each other nicely with our viewers. So allow me right now to introduce to you a friend of mine and a very special guest who will take us through what we need to know when it comes to the issues of COVID-19. By the way, have you been affected? Have you been infected? Have you been vaccinated? Are you among the people who are saying that the vaccine is not working? We want to know. You can ask your questions, yeah? You can ask your questions. You can write your question, and Dr. Aiena will be very sure to answer to the best of his ability and to the best of his knowledge. So one-on-one with Dr. Aiena. How are you, Daktari? You know, in my language, we call doctor Daktari. So allow me to say Daktari. How are you, Daktari Aiena?
I like that. I like Daktari. Andrew, I'm doing well. Thank you so much for having me. Trust me, the pleasure is mine. It is an absolute honor to get to be on your show. I'm so excited to be here. I'm excited to get the word out about how to keep your listeners safe and your viewers safe. I think that we can have a really good conversation here and hopefully teach some people a few things along the way.
Thank you so much. Let's first start with a brief introduction of who Dr. Aiena is. I just mentioned that he's the director of the Walker County COVID response. So let's know a little bit about who Dr. Aiena is.
Sure. So I currently work at Huntsville Family Medicine in Huntsville, Texas. I'm originally from a small town called Sour Lake, Texas, near Beaumont. Went to undergrad at LSU and did my medical school at Texas Tech. Did my residency training in Conroe, very near here, and have been in Huntsville ever since. My wife and I love the community. I have two beautiful kiddos, just wonderful kids. Huntsville has been very welcoming to us from the very beginning. So it was very easy for us to get involved with the community and something that came very naturally. Once COVID came around, once we kind of saw that we were going to need someone to advocate on behalf of Walker County to get vaccines, to get the events up and running, I was more than happy to kind of take up that mantle, so to speak. We were able to get the vaccines down to Walker County, and we were able to vaccinate about 500 people a day in Walker County through our mass vaccination events on a budget of $0. But we had a huge team. The Office of Emergency Management pitched in. I had an incredible team of volunteers. This was a takes a village kind of moment, and the way that the people of Walker County came together was just amazing. So we love it here.
Thank you so much. So as we speak right now, what are the numbers out there when it comes to the issues of COVID-19? Are we still way high?
Yes, sir. And they're changing. To say by the minute is not an exaggeration. Omicron has really swept Texas and the rest of the world. When we look at the graphs and compare the numbers of infections of Omicron to the previous wave, which is Delta, we're more than twice as high now on the numbers of new cases per day. And you got to factor in a lot of that's home testing that people aren't counting, that aren't necessarily in the numbers. And a lot of it is people that frankly just can't find a test. So the true numbers might be higher. And that's what's so worrisome about Omicron. One thing I said on a radio show I do, Thursday Morning House Call on KSAM and KHVL, is I challenge any of our listeners to not know someone that has or did not recently have COVID at this point. So the numbers are still very high.
Thank you. We have been speaking about the vaccines. Let us do an introduction of the whole issue about vaccines from when we started with the different types of vaccines to the moment where we are talking about the booster shots. And when you answer that issue, or when you handle that particular issue, please talk about the importance of being vaccinated and who is supposed to be vaccinated. It's a whole lot of A, B, and C, and D.
Absolutely. If you're listening to this, you should be vaccinated. So that's a quick one, unless you have any 4-year-old listeners, which maybe you do, which would be wonderful. But we'll get to that last in just a moment. So looking briefly at when the vaccine was made, believe it or not, we just got past the 1-year anniversary of the vaccine coming to Texas just a few weeks ago, which was a very exciting anniversary for us. It is an mRNA technology, which I'm sure everyone's at this point familiar with and you've heard of. And I'm going to dispel a few myths along the way as we go. The technology behind the vaccine itself has been under investigation and being worked on for over 25 years. This is not new science. This is not new technology. This is something that science has been experimenting with and is very confident in after over 2 decades. One question I get a lot is, since it's mRNA, can it change your DNA? It cannot. In the human body, the mRNA cannot go backwards into DNA. It cannot affect your DNA whatsoever. Mm-hmm. So I wanted to dispel that myth with our listeners. Here in Walker County, I know I personally have overseen the giving of well over 10,000 vaccines. We may be getting to 20,000 at this point, and our patients have done very, very well with it. No medicine is completely benign. No medication has 0 side effects. Tylenol has a potential for side effects. Penicillin has potential for side effects, and we write for that every day without thinking. The side effect profile for this vaccine is very low, which is great. We were so blessed to have this available, to have this tool, because prior to this, it was do your best to stay away from it. When the vaccine first came out, we were against what was called the alpha variant. So when I say alpha variant, I'm referring to the first version of COVID before it began to mutate. And it was very, very effective, around the range of about 94 to 95% if you're looking at the Moderna and Pfizer 2 vaccine series. Delta came along. We still saw great efficacy, probably in the 70s to 80s, depending on which study you were referencing, Pfizer versus Moderna. Omicron has changed things a bit. Mm-hmm. Now, let me say this before I go any further. The vaccine is still very effective, especially at preventing serious disease and death. And that is ultimately our goal, is to keep people out of the hospital system and to keep you, the listener, healthy and safe. If I had to choose between the worst flu of my life and a mild cold, I'm going mild cold every time. The vaccine, in my experience, has also kept patients from suffering from what we call long COVID. Unfortunately, long COVID is kind of the silent, detrimental thing of this whole pandemic. People don't talk about it. I have patients, unfortunately, that have the chronic shortness of breath, that get fatigued very easily. Some have joint aches that I can't explain otherwise, that we can't treat. The vaccine can help prevent that as well. Now, a lot of talk is going on about, is the vaccine still effective against Omicron? Yes, there are still breakthrough cases. Absolutely. There are still breakthrough cases because there have been so many mutations. You can still have a breakthrough case. But every breakthrough case I have seen in my practice personally has been very minor. Anything from asymptomatic to a bit of a stuffy nose. As a matter of fact, I had a patient this morning that I personally swabbed, who had a stuffy nose and a little bit of a sore throat, who turned out to be positive for COVID. But this patient had been vaccinated and boosted. That booster comes into account, especially for Omicron. Once you get the booster, the efficacy of the vaccine goes up quite a bit, specifically with Omicron. All of my patients that are vaccinated and boosted have done very, very well. If you are someone that is older, over 65 specifically, if you are somebody with diabetes, hypertension, overweight, a smoker, you really, really need to strongly consider getting the vaccine and starting the series if you haven't. At this point, I'm not really even calling the third shot a booster anymore. It's a 3-shot series. We have vaccines like the hepatitis vaccine, for example, that have been a 3-shot series forever. We don't call the third shot a booster. We call it the third shot. I think there's enough data now to show that the efficacy goes up enough with the third shot that we can start to comfortably refer to this as a 3-shot series. People ask me, why did that change? Well, we're still trying to see what's going to be safest for you. They do the studies, they watch the people that have had the shots, and they see what's going to be safest for our patients. Is 2 shots better? Is 3 shots better? And right now, 3 shots seems to be a good place to be. Ultimately, the rules haven't changed. And we said this on our radio show not too long ago, the rules haven't changed, especially during Omicron. Wear your mask. During the original variants of COVID, it was very difficult to catch COVID at the grocery store. Now, I can confidently say I have had patients catch COVID at the grocery store. Wear your mask. Try to avoid large gatherings. Just be smart while the numbers are this high. This isn't forever. Like the Bible tells us, this too shall pass. We just need to be smart while the numbers are this high. I cannot tell you how many times, if I could associate a few sentences with COVID, it's I was at a birthday party, I was at a wedding, I was at a funeral, and Uncle Jimmy didn't know he had COVID. It's every time it's these gatherings. It's not big outdoor events. Typically, it's these indoor family gatherings where someone with good intentions was in the asymptomatic or mildly symptomatic phase. And especially with Omicron, if you are in the room with that person, there's a high likelihood you're going to get it, especially if you're not vaccinated, especially. Omicron does tend to be more mild, which is wonderful. We have been looking and hoping for that change for a while now. It still can cause hospitalization. You still just need to be as cautious as you can be.
Great information right there. Thank you so much. Dr. Aiena is at the Huntsville. He works at the Huntsville Family Medicine, and also is the Walker County COVID Response Director. And so the information that he is giving us is the information that is supposed to be given out as per the Texas Health Department. And it is important to know that there is a lot of information out there, but not every information is right information. We have a lot of fears, we have a lot of myths, we have so many people who are thinking, hey, will I get this COVID-19 shot? If I don't get the shot, I will get COVID. If I get the shot, I'll be so-and-so got the shot and he got more sick. And I think Dr. Ari has just mentioned a little bit about the reactions. And I would wish he repeats that about the side effects.
Sure. No, that's a great question. Side effects can be part of it, especially if you had COVID before. The side effects you get from the shot are your immune system reacting to the shot. Like I tell my patients, that's a good thing. I know you don't feel good, but your immune system's working. So if you have not had COVID before, the first shot is typically very well tolerated, very, very well tolerated. By the time you get to the second shot, it varies, very much so. And I'll use kind of my own personal experience to speak to it. For my second and third shot, I was achy and had about 100-degree temperature for about 24 hours. It started about 8 hours to 10 hours after I got the vaccine, lasted 24 hours. Nothing that a little Tylenol and rest couldn't take care of. Then you look at, say, my pawpaw, very healthy guy in his 80s. He has gotten all 3 shots, and pawpaw is a tougher guy than me. Don't get me wrong. But so maybe he just wasn't telling me, but he had no side effects whatsoever. He never would have known he'd gotten it. So it's going to vary. Most side effects are mild. The incidence of a severe reaction or allergic reaction or a severe side effect, very, 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 very little. And the example I use is just go talk to your doctor or your a hospitalist that you may know or an ICU nurse or somebody and say, okay, who's in the ICU right now? Is it COVID patients or is it people that had reactions to the COVID shot? It's not this one. It's not reactions to the COVID shot. It's people with COVID. And if you look at the numbers, even from our own local hospital, I like to keep numbers as local as I can. That just means more to folks, you know, for something that you can physically touch and affect you personally. Our local hospital is still 80 to 90%, closer to 90% usually, if not over it, 90% unvaccinated that's hospitalized, only around 10% that's vaccinated and hospitalized. And those people are sicker, they have other comorbidities going on. There's usually other factors playing in. Just looking into it, COVID in and of itself, objectively, is just so much more dangerous. If you want to protect yourself from COVID through many means, through the masking, through the avoiding the big gatherings, and through getting the vaccine.
Awesome. Thank you so much. When we come back, Dr. Aiena will handle the issue of the difference. This is a question that is coming up. The difference between the normal flu that we usually get and the COVID-19. How do I tell? Am I having a cold?
Great question.
Am I having this or am I having this? Shortly here at Rafter. This is the Trumpet of Hope, and we are broadcasting to you from Texas. Our guest tonight is Dr. Lane Aiena, who is the Walker County COVID Response Director. What do we need to know? Don't go away. Thank you so much. Thank you so much. I'll be recognizing our viewers and our listeners wherever you are. If you have any concern, if you have any question, if you have any issue, please be sure to send us a short message. You can either send it to my number, that is 978-227-6484, or you can just write it down there as a message, and we'll be able to answer it right away. As I just said, we have our guest tonight, who is Dr. Lane Aiena, Dr. Lane Aiena, and that made me very happy because it is not hard to pronounce. Aiena is the director of Walker County COVID response. We are on safe hands. Dr. Aiena, differentiate between the symptoms of normal flu and COVID-19.
Very good question, and that is because it is very difficult, even for a physician, to determine between the two. Previously, with the Alpha and the Delta waves variants of COVID, loss of smell and loss of taste were the big differentiation. And a lot of times, us physicians relied on that to tell patients whether or not we're leaning more towards COVID or more towards flu. Mm-hmm. I'm not seeing that as much with Omicron. I'm still seeing it. I just heard of a close friend of mine losing the sense of smell today, so it can still happen. I'm just not as reliant on that. Outside of that, Omicron also doesn't seem to affect the lungs as much, which is a good thing. The Alpha and the Delta variants were hard on the lungs. This doesn't seem to be as hard on the lungs. But this is bringing the flu and COVID closer and closer together. So there is not a concrete distinction anymore that I can make verbally to you. If you have muscle aches, fatigue, stuffy nose, sore throat, headache, I'm covering both diseases there. What I tend to tell patients is, if you can get access to a test, get a test, because knowledge is absolute power. First of all, you don't want to spread either to your friends and family. If you're feeling poorly, you don't want to give your family the flu any more than you want to give them COVID. So you want to make sure you're staying in. But it's good to know what you have. COVID now, we're starting to have medications. We just got in Huntsville molnupiravir, and I apologize if I mispronounced that. It's all very new to me. But we just got that locally, and I have been personally talking with Pfizer and the DSHS to try to get that drug down here as well, which is in the works. But anytime you're dealing with governmental entities getting something out, it's pretty difficult to get those wheels turning. And I'll leave it at that before I get myself in trouble. But you need to know what you have to treat it appropriately. We've had a medication for the flu, Tamiflu, which I'm sure you've heard of, for years. It works very effectively, especially if you started early. And now we potentially have good oral treatments for COVID. It's important to get that test if you can find it to know which one to give you. You certainly don't want to just give both and hope. We have flu tests available. Flu tests, luckily, are not in short supply right now. It does look like this is ramping up to be a flu season that may have substantial amount of flu burden, so we need to be cautious. But the rules with the flu are pretty similar. Try to avoid the big gatherings, wear your mask, wash your hands, all important stuff. Flu doesn't tend to be as easily spreadable as COVID, nor does it have near as much of the asymptomatic spread so far from what data says as COVID, which is why we tend to see COVID a lot more. But if you're on the fence, if you don't know, my best advice, call your physician. See if your physician can tease it out and see if your physician can help you get access to a test.
Thank you so much. As we continue, it is important to ask this question coming up. How are you advising mothers who are either nursing or who are pregnant when it comes to the COVID-19 shots?
Great question. Let me say this before we get into specific medical advice. Anything I say on this video does not replace what your physician tells you. So while I'm happy to give guidance and what I'm doing in my own personal practice, it is not a replacement for advice from your medical doctor. So before you take advice from me, I'm happy to give guidance, but if this is a person-to-person question, I advise you, please go talk to your doctor because each case is different. That being said, I am comfortable telling my pregnant and lactating patients to get the vaccine. We probably will never have a big double-blinded study on pregnant women because no one wants to do a study on pregnant women. I know I wouldn't. You're affecting 2 lives at that point. It's a heavy burden. But what we can do is look back retrospectively on patients we've had that were pregnant that either were vaccinated already or got the vaccine while they were pregnant, and they have done well. Mm-hmm. I've had different physicians approach this differently. I believe ACOG, and I'd have to look this up, I believe ACOG, which is the American College of Obstetrics and Gynecology, I believe they are in support of the vaccine in pregnancy, but I'm going to have to look that up after the show and get back to you to make sure. And if we have any listeners that are familiar with that recommendation, feel free to correct me. But that being said, we don't want our pregnant women to get COVID. COVID is a bad disease, and pregnancy is a high-risk state to be in. Again, it is a very personal choice between you and your physician. I would recommend you speak to them about it. But me personally, I am, at this point, based on current available data, comfortable recommending it.
Thank you so much. There has been a push for the vaccination of young children. I don't know how it is right now in Walker County. I know that we have Kenyans from my community here working with the prison and others who are working in the health industry. Can you please mention what your advice is in terms of vaccinating children?
Sure. So children tend to do better with COVID, which is good, but children can still spread COVID. Mm-hmm. Personally, my daughter is 5, and she was the first 5-year-old in Walker County to get her COVID vaccine. So I am obviously a believer in it. If I personally held my daughter while she got it. She did very, very well. She is the bravest little girl you'll ever meet. So she did great with the shot. Again, though, this is a talk that you need to have with your pediatrician for the specific recommendation. Mm-hmm. For my patients, we discuss it. We discuss risks and benefits. I'm very comfortable with the shot. And so far, my pediatric patients have done very well with it. I am in full support of it. But each kid's going to be different. Each case is going to be different. I think it's an important shot to get. I think it's going to become more of a routine shot as time goes on. So yes, I do think it's a good idea.
Thank you so much. As we continue, our viewers, thank you so much, Victoria Mwams. She works down in Houston. She is she's in the health industry. Dr. Jenny Rongo is in Oklahoma, says, I am recovering from COVID-19, yet I'm double vaccinated and got a booster. How comes?
It is the breakthrough cases. It's Omicron. The way Omicron can get into your cells is with its spike protein. And there's a lot of different variables that come into play after that come with viral load, for example. Physicians and nurses are more examples to come in contact with more of the virus at once. And there's some evidence that shows that someone who gets in contact with a bigger viral load is going to have potential to get sicker than someone that didn't. Unfortunately, nothing is perfect. No medication is perfect. Nothing that we humans have created has ever been perfect. And Omicron has further thrown a wrench in that plan. That being said, while it certainly does not reduce your risk 100%, it significantly reduces your risk of getting COVID. Now, the shingles vaccine doesn't reduce your risk 100% of getting shingles, but it does a pretty significant job. Everything's about risk reduction, and the COVID vaccine significantly reduces the risk of getting COVID. Unfortunately, we don't have a way of eliminating that risk like we have with polio, for example. But hopefully that is something that can come in the future. The mutations make it more difficult. Obviously, we don't want to get a new shot every time there's a new variant. The treatments are promising. I've always said that if we can have a good vaccine and a good cheap treatment that we can make available, we could get ahead of this thing. But unfortunately, there are people that, despite doing quote unquote everything right, is kind of the phrase that I see online with hear from my patients, you can still get ill with it. Really sorry to hear about that, about your listener, by the way, in Oklahoma. I hope you get better soon, and I hope that you're feeling good in no time.
Thank you so much. Somebody else is asking now. This one is from listening to us through our app, and he is asking, when is it the right time to go and visit a doctor? Because I think you have the COVID. Nowadays, there are these home-based test kits, and you realize that I'm having COVID, but I'm not so bad. Can I stay at home until I get better, or should I visit a physician?
Another fantastic question. I would always err on the side of contacting your physician. And again, that's because a lot of patients have these other things going on, diabetes, hypertension, heart disease, that we've got to take into account. Now, you know, my healthy 21-year-old that get a mild case and don't call me, I certainly don't begrudge them that. I definitely understand it. As long as they're doing the right thing socially. Just because you feel like COVID's mild doesn't mean that everyone that might catch it from you will get a mild case. So that's the social responsibility aspect is one that I cannot overstate. I want to take a little bit of his question and segue a bit. The home tests. I get a lot of questions about accuracy of home tests. With Omicron, a negative is not quite as trustworthy as a positive. If you get a positive home test, you can pretty much take that to the bank. Again, nothing that humans have created has ever been perfect. There's no perfect test. But if it's positive, it's positive. If it's negative, but you've lost your sense of smell, you're fatigued, you've got a bit of a cough, you've got a sore throat, you've got a stuffy nose, it looks like a duck, it quacks like a duck, don't go to grandma's birthday party. You know what I mean? I mean, you've got to use some of that thought process there. And again, that'd be a great time to call your doctor. Your physician, we've been dealing with this for 2 years. We've developed, unfortunately, an eye for this kind of thing. If you have any question about it, it's always safer to drop a line to your doctor, send them a message, give them a call, talk to the nurse, have an appointment, and they can help stratify the risk. I'm never going to say to avoid that. I think that that's always going to be the safer idea as far as keeping yourself and the population safe.
Thank you so much. We are talking to Dr. Lane Aiena. Dr. Lane Aiena works at Huntsville Family Medicine and is also the Walker County COVID Response Director. This is important information. People have died. We have lost our relatives. We have lost our friends. We have lost people we went to church with. We have lost people we met at a wedding and they got sick and they left. I know we have had so many people, being called back in Kenya to go and bury their relatives. Some people have not been able to even go for these funerals because of the conditions and the regulations with the travel and with the barriers back at home. So it is a serious issue. And I would wish Dr. Aiena to just give us a recap when it comes as in the issue of the importance of being vaccinated, either the first shot, the second shot, or the third shot. Please insist on that.
Certainly. Just to kind of recap, it is important to reduce your risk of significant disease. It is it can help prevent the disease altogether. And if you have a breakthrough case, getting the 3 shots, now that we're with Omicron, it seems like the 3-shot series is your best shot. It significantly can reduce your chance at significant illness or death. So hospitalization, death, etc. And again, even in my personal practice, which I've lost count of how many COVID patients, unfortunately, I've had, the people that are vaccinated tend to be doing much better than the people that were not. And so we can go from the scientific numbers to just what I've seen. And you hear it over and over and over. Now, there's a lot of stuff out there that you can read, but you got to kind of cut through that. Remember that a lot of what you read on Facebook, Twitter, Instagram, people that post that don't know you. They don't care about you. They probably have ulterior motives. Your physician that you have a relationship with does care about you, and they can help you make a decision and guide you in that decision making. So I always want to make sure that people know that to do the right thing there, to talk to your physician, get the vaccine, keep yourself healthy, keep your community healthy.
Thank you so much. In those 2 things that you have mentioned, keeping yourself healthy and keeping the community healthy, can you talk a little bit about the vitamin D? And people have been saying, hey, I'm taking zinc. Dr. Jane said, hey, I'm doing good. She's based in Oklahoma, and she says she's doing very well. And she's also making use of the vitamin D and zinc. What are some of those healthy practices that you would advise somebody who is in isolation or somebody who has tested positive? I have my friend Danny Moore. He is based in Seattle, Washington. Says, great topic. I'm in isolation at the moment. Hey, talk about this.
Sure. No, and I recommend vitamin C, vitamin D, and zinc to my patients without COVID. Excuse me. If you try to look at data to make decisions like this, and the data that I can find, it seems to be particularly, I would say, the strongest with vitamin D, especially for people that had a good vitamin D level before they contracted COVID. Now, some warnings, a lot of this is correlation. We all know correlation does not show causation, so it's not concrete proof. But vitamin D is, if you're taking over-the-counter levels, very difficult to hurt you. Now, don't take any of this without talking to your physician. I can't say that enough. But taking an over-the-counter supplement while we're in these large numbers of vitamin C, vitamin D, and zinc, I think is a great idea. Now, it's not a replacement for wearing your mask. It's not a replacement for getting the vaccine. But if you're really trying to do everything, do it. The analogy I always use is, why should I wear a mask if I got a vaccine, or vice versa, or why should I take vitamin D? I drive safely and I wear a seatbelt. I do lots of things to keep me safe. It's okay to do more than one thing to keep you safe. Again, it's all about risk reduction. We can never bring a risk down to 0, but each time we can bring that risk down is a positive thing.
Thank you so much. Talk about the safe practices for somebody who is in isolation after testing positive, like my friend Danny Moore and others who are in isolation right here in our city.
Yes, sir. Well, first of all, I hope your friend gets better quickly. All of our listeners right now and viewers that have COVID, I certainly pray and wish for you a speedy recovery. This is an ever-changing topic. And if you've been following along with the CDC, the guidance has been changing recently, and there's been some question as to where did the change come from, what was the science behind it. And I think the CDC, especially if you look at this weekend, has done a decent to good job going out and trying to explain the reasoning behind it. The current recommendation, and I'm going to try to say it as best as I can from memory, is you take 5 days from the onset of symptoms or the positive test, whichever came first, and you go into complete isolation. So 5 days from then. If you are asymptomatic, then you can go back to work for 5 period, but for 5 more days, you have to wear an N95 mask and eat alone. The previous recommendation, which was a lot easier to follow, that I'm still recommending to a lot of my patients, is a 10-day quarantine, and you can come out as long as you're 3 days fever-free without Tylenol. I'm not 100% on board with the 5-day yet. I'm waiting to see a little more data come out. I will use it if the patient is stone cold perfect as far as symptoms go and very mild case, and I know they're the kind of person that'll wear an N95 all the time. yeah, I think we can go with CDC guidance on that. But if you want to be 100%, well, nothing's 100% safe, right? But if you want to be really safe, the 10 days with 3 days being fever-free will usually do pretty well. And then I always say, if you've got an older family member or a family member that has cancer, or that's undergoing treatment, or some kind of immunodeficiency, I always tell them to wait 14 days. I know that seems extreme, but you got to do what's right for those patients. Always wait a little bit extra to go see them. So I know that's confusing. It's confusing to us physicians too. But CDC, just to briefly review, CDC, 5 days quarantine, 5 days with a mask, eat alone. Previous guidance that's still in use quite a bit, 10 days with 3 days fever-free. And then if you have an ill person you're going to see, 14 days. Ill being immunodeficiency, cancer, etc.
Thank you so much. This is Dr. Lane Aiena, Huntsville Family Medicine, and also the Walker County COVID Response Director. So whatever we are saying is what is supposed to be said as per the CDC. There are some myths that the whole issue about COVID is conspiracy theories. Would you please, from a point of information, speak about the reality on the ground?
Yeah, absolutely. And I'm glad you asked that, because I think this is something that we need to face head on. One of the things I appreciate the most, and I mean this from a genuine place in my heart, is when a patient comes in and has enough trust in me to have an honest discussion about the theories that they've heard on Facebook. Obviously, you and I don't have time to hit all of them. There are plenty of them out there. So instead, I'm just going to paint the reality for you of what's actually going on. I am seeing more COVID right now than I have ever seen, which is saying something, because Delta was so significant, we started a radio show to get the word out. I mean, so we've doubled the significance of an already really bad wave. The hospitals are full again. If you look at any of the numbers, that's true. Just last week, I had a patient with a bad leg infection that I could not get into an emergency room. He and his family, a longtime patient of mine, I see the whole family, they called around and called us back worried and nervous and panicked, and we were too, saying there's nowhere available. There are no beds at the inn, so to speak. So we've had to treat these things that we never would have treated outpatient as an outpatient, because hospitals are full. The burden on the medical community is just too great for what the medical system is equipped to handle right now. That's the reality. Even if you are a 35-year-old, perfectly healthy, you jog every day, if you get in a car accident today and there's no room at the hospital, suddenly COVID has affected you directly. Or if someone has a heart attack, or God forbid, something like a stroke, something along those lines, or a leg infection, we can't get people in the hospital right now. That is not an exaggeration. That is not a conspiracy. I gain no money from saying that. I am being paid by nobody outside of Huntsville Family Medicine. I am not a Pfizer shill. I'm lucky they pick up the phone for me, frankly, when I call them. So if you just talk to your physician and have an honest conversation, what does it look like out there right now? What is my actual risk? And what does this look like on a community level? Looking outside of me, what does it look like on a community level? It is very, very much real. There is no government conspiracy as to why the hospital is full right now. It is full because of disease burden. There's no government conspiracy as to why you and I are speaking right now. We care about our listeners and we want them to be well, and we want our communities to be healthy. Separate the government out of it. Just completely separate the government out of it for a moment. The government didn't create the shot. The scientists did, and they are not political. Your physician, I hope, is not political. Your physician is somebody who cares about you and wants you to do well. You've got to separate those two worlds. And that's what I tell patients all the time, is you've got to separate this intertwined reality. I know it's tough because oftentimes politics turn the wheels of medicine, unfortunately. But you got to take those apart. You got to take the conspiracy, kind of separate it out. And like I said, if you've got some questions, absolutely. There's nothing wrong with going to ask your physician. I love when people ask me those questions. I genuinely do. And some of the best conversations I've had in the last 2 years with patients that have done that.
Thank you so much, Dr. Lane Aiena. And I want to thank our viewers and our listeners for tuning in to this broadcast. We only have a few more minutes. Can you please speak about the right? I don't know whether you have a mask around anywhere near you, but I have seen people make mistake when it comes to the use of masks. I have
Yes.
seen people make mistakes and serious mistakes when it comes to the use of masks and even which mask to use.
Yes. So first of all, if you're not covering your nose, what are you doing? I mean, if you're wearing the mask down here, you're exposing the part that I swabbed to find out if you have COVID. So you've got to have, I know it's not comfortable. Trust me. I'm a chubby guy with asthma. I don't want to wear a mask either. I'm sick of masks. I hate masks. I'm going to throw a party the first day I can go to HEB without a mask on. So I get it. I really do. And I empathize. But if you're going to do it, you got to put it above the nose and around the mouth. With Omicron, unfortunately, it looks like cloth masks don't work as well. And it's just part of the reality on the ground. Those studies are still new and ongoing. I may be wrong on that because the studies may change as time goes on. But luckily, we're in a time now that is not like April of 2020, which is crazy how long ago that feels like. In April of 2020, as everybody remembers, we didn't have any personal protective equipment to use. Even physicians' offices didn't have masks. And it was a big deal for us to go advocate for masks, for gloves. We're blessed right now that we can go to most stores and find a good surgical mask. If you want to go in order of, I'd say number 1, 2, and 3, number 1 is the N95. You've all seen them, the big circles. They make a good seal. Those are the safest. The KN95 is right below it. I think it's 99% effective, and then 95% for the KN95, I believe. So also a very good mask. The KN95 is what I typically use because I can breathe a little better. It's a little more comfortable for me, unless I have an acutely ill patient, in which case, like this morning, I will switch into an N95 to keep myself and my other patients safe. Mm-hmm. And then after that is the surgical mask. A well-fitted bent bar surgical mask will provide some protection as well. If you're going to get a mask, I would recommend them in that order for which one to get.
Thank you so much. Mention a little bit about the cloth mask, because I think that is what many people are using. I know you mentioned it, but I don't mind you repeating that. We have a few more minutes.
And just, from what I'm hearing and seeing in emerging studies, they don't work as well. I can't put a number on that. If it's all you have, I refuse to believe it does nothing. It has to do something. I refuse to believe it does nothing. But if you're going to if you have the ability to get a mask, if you have the ability to find a mask and purchase that, I would recommend one of the other 3 if you can get one.
Thank you so much, Dr. Lane Aiena, the Huntsville Family Medicine. For those who are in Huntsville, Texas, for those who are in Spring, Conroe area, for those who are in New Waverly, for those who are anywhere near Huntsville, Dr. Lane Aiena is right here, Huntsville Family Medicine, and he is the Walker County COVID Response Director. We have worked so hard to ensure that we get this program. We have been in and out sending emails, and I want to really take this opportunity to appreciate Dr. Lane Aiena. On behalf of the team that has been pushing for this show, I would wish to say thank you so much, and we are looking forward to working with you. Now, specifically in here at home, here in Huntsville, I know there's all these, the Kenyan community, the people working at the prison, the people working at the health industry. I don't know, what would you say that is narrowed home, narrowing it home to Walker County and more specifically, maybe Huntsville?
So a specific message I would say if you're looking at Walker County and the biggest employers of Walker County, I think you've mentioned the biggest one, which is the prison system and those that are employed through that, the Texas Department of Justice. Then you're looking at the college and the hospital, I believe, and maybe Huntsville ISD. All of our highest employers in the area are high risk for COVID, especially up here at number 1. Just a quick thank you to our people that work for the prison system or anywhere associated with that, the Texas Department of Criminal Justice, thank you, thank you, thank you, thank you. You are a unsung hero on a front line that is all too often forgotten. You are really, really doing an incredible job, and I want to thank each and every one of you. And I'm glad you brought that up so I could have that opportunity to thank them, and the biggest platform I've had so far. Do everything you can to protect yourself. Wear the mask, especially while you're at work. Make sure you wash your hands. Make sure you do everything you can to keep yourself safe and your family safe and your community safe. I think y'all are doing a fantastic job. Just keep up the good work and hang in there. Hang in there. You're doing awesome. Hospital workers, same thing. Our hospital workers, our medical community as a whole is so just burdened and burnt out at this point. Keep doing the right thing. Keep working at it. Let's keep the community healthy. And then for Sam Houston and for our teachers, goodness gracious, the work you guys have done to keep the schools open is one of the things that history will look back on so positively for this, was the work that, and here in Walker County, I think Huntsville ISD has done an incredible job. I'm in on their emails because I have a kiddo in school with them. I could not be happier with some of the things they've done. Keep yourself safe, keep your community safe. Let's keep the schools open. Let's keep Huntsville healthy.
Thank you so much. A final message from Dr. Lane Aiena to the Kenyan community watching and listening to this broadcast. Maybe 1 or 2 points that you would wish to repeat. We have just a few minutes before we wind up.
Absolutely. Get your shots, all 3 of them. Wear your mask. Avoid the big gatherings. This too shall pass. Let's do the right thing. Let's get these numbers back down. Keep yourself healthy, and let's keep Huntsville healthy.
Thank you so much. That was a beautiful program, Dr. Lane Aiena. I take this opportunity to thank you once again for accepting to come at a time that when you're supposed to be resting together with your family, and you chose to come to this very broadcast. And on behalf of our viewers, on behalf of our team, they are saying thank you, Doctor. Great information. Kairitu Kajeso, thank you so much. Danny Moth says, thank you, Dr. Lane and Captain, for your time and information. Thank you so much. Teresa Eric in Seattle, Washington says, good topic. And Suzanne Maina, thank you so much. Dr. Jenny Rongo, thank you so much. Wangeshi Rachel right now listening to us from Arizona. She's based in Houston, Texas. No, she's based in Seattle, but right now she's in Arizona. I have my friend Jen Moshene. She is right now in Massachusetts, and she is listening to this and says thank you. Victoria Moms is a health practitioner based in Houston, Texas, and she totally agrees. MD Minor, thank you so much. Gregory Moshiri is in Kenya right now.
Wow.
He's watching this all the way in Kenya. Karim
Very
Emi,
cool.
Thank you so much. She's Carrie is in Atlanta, Georgia. I have Dr. Our in-house Dr. Anje here. He is based in Indiana. I see them behind the scenes, based in Indiana. He was the first person who I invited in the show when COVID came up. Nobody was speaking about it, and he came in and had some shows here. And let me tell you, it was just awesome. He's a doctor based in Indiana. King Jabran, thank you so much. We really appreciate Daktari. Thank you. I told you Daktari is the Swahili word for doctor. So it's Daktari.
I love it. Daktari. I love that word. That's great.
Josephine Kanai is right here in Huntsville, Texas. One of the people working for the for TDCJ, and says thank you. I'm reading a few comments. Thank you so much, Minor Joseph. Thank you. Anastasia and Jerry is in Dubai. Anastasia is in Dubai. Tabs Diary Bob, thank you so much. Danny Moore is based in Seattle, Washington. Lois Wango, thank you so much. Lucy Agaite, thank you so much. Dr. Jen, thank you so much. Minor Joseph. Lois, thank you so much. Hey, it is awesome to have all of you. And the doctor just said, wear your mask, get your COVID shot 1, 2, and 3, and also, hey, if you don't have to go to these crowds, just stay intact. It's going to go.
Agreed. Man, thank you for having me. It has been an absolute honor and a privilege. I can't tell you how much I appreciate getting a chance to kind of get the word out. I can't tell you how much I appreciate the kind words of the listeners. That is just incredible. So thank you, thank you, thank you. I can't tell you how much I appreciate you having me.
Thank you. Let me teach you one more word. Asante. Asante means thank you. So in my language we say asante. That is thank you. So all these people are saying asante.
Well, from the Daktari, asante.
Thank you so much. Wonderful, wonderful, wonderful. That was a moment with Dr. Lane Aiena, and I know that you have learned something. If you have learned something, please, you can share this broadcast with your viewers, with your friends. It is important. Hey guys, if you've been infected or affected by this by this COVID-19, it is important for us to love one another. It is important for us to share information. It is important for us to treat each other with all the respect and love that we can. If you can be able to do this, please wash your hands, share your, share the information, use your masks, and also get your shot 1, 2, 3. And if we have to go to 4, 5, and 6 and live and more, if it is keeping us alive, we have nothing else that we can do. If that is what we are going to do to stay alive, hey, we better do it. And Daktari has actually said it is not just a conspiracy theory. I know some people are playing up, joking around that issue, conspiracy theory. It is not just a conspiracy theory. Scientifically, and history has it, of what happened in the Spanish flu of 1918 and everything else that we are doing. Can we keep ourselves safe? Yes, we can. We can conquer these. We can conquer these too. And we can win this together. We'll be back with Charles Geshoke shortly, but that is in another very special broadcast that is coming up. So for now, I take this opportunity to wish you the very best. God bless you. Let us pray for one another. Let us do what is right. Please have your shot, 1, 2, and the booster. Keep your distances. It is important. China just got into a lockdown ahead of a very big game. Yeah. Let us do what is right. If you can get a shot, please do it. If you can help somebody by, wearing your mask, wear your mask and do it right. Some people are wearing masks but doing it wrongly. And that one will be okay. So God bless you so much. On behalf of everybody else, God bless you. Good night.